Hi, my name's Ian Taylor from Wolverhampton. Diagnosed with prostate cancer 18 months ago. Been on active surveillance for 18 months, regular PSA tests. Time's come now, as the disease has spread and become more aggressive, to have a prostatectomy. I'd just like to share my experience of how that's affected me. It's been very anxiety provoking. I've emotionally been affected by this, the most I've ever been affected by anything in my life. It's a very stressful time. How have I dealt with this? Well, from the start, I was very open with friends, family, and work colleagues of my diagnosis. This has been really useful as it's enabled them to support me and just ask how I am. I've spoken to lots of friends and good friends who have kept in contact just to say how are things going, how are you feeling. About a month ago, 6 weeks ago, decided that prostatectomy was needed. This has affected me greatly, psychologically, but with the help of family, friends, work colleagues, it's helped. I've been able to speak to people when I've needed to. I also joined a Wensfield men walking, talking group. That's really helpful. Just walking, talking to a group of guys, and one specifically a gentleman about my age who'd had the same diagnosis and prostatectomy back in February. It's been so useful to talk to somebody who's been in the same situation and has had the same procedure that I'm going to have. I also used Prostate UK, a helpline, and I was given a support worker, again a gentleman who has had prostate cancer but is through the other side, having had a prostatectomy some 4 years ago. So it's very helpful to ask questions and listen to his story and listen to the fact that he felt exactly the same as me. And Prostate Cancer UK, I also spoke to their specialist nurse who was able to answer my questions from a medical point of view, more than support workers there, not just to give you, he can't give you medical advice, but he can just talk about his situation. So, as they say, sharing is caring, and it's been invaluable really to speak, to be able to say, I'm not all right. I don't feel like I'm coping with this. When I actually am, it's just normal. And prostatectomy is due on the 1st of December, which is in 4 days' time. So I've started to feel a bit less anxious really, because it's here, it's going to happen. Hopefully I'm going to end up cancer-free, which will be great. So my advice would be seek help. I've done that. I'm a psychiatric nurse. I've done all anxiety management training and CBT training, but it's different. So seek help, talk to somebody. That could be your wife, your partner, could be relatives, could be work colleagues, whoever you feel comfortable sharing this with. But it's okay to feel anxious. You're going to feel anxious. You know, that word big C, will get anybody anxious. So just share, talk, and allow yourself to ventilate how you feel. Try and keep active. I've done a lot of running over the last 18 months, which has been my saviour as well. So keep active. You know, you need to be fit and healthy for this operation. And then we'll see. I'll see what things are like after my prostatectomy. I'll continue to talk to people, get help, support. And I'm sure things are going to be all right. Fingers crossed. I'll let you know.